I just want to make sure that everybody understands just how heroic the work is that's happening from our Haitian team in Fondé-Blanc, making sure that the hospital continues to run. Right now, the hospital, despite all of these tremendous challenges, is running relatively normally. It is a testament to the work and the heroic work and courageous work of our team that's happening. We have over 25 babies in the NICU. We continue to provide emergency C-sections, general primary care, and now are setting up a cholera treatment center as cholera has come back on the scene in Haiti with a horrible outbreak for the first time in 3 years. We are confronting so many different challenges, and our team is confronting so many challenges, but the work remains a beacon of hope, and the team is resilient and finding ways to make it work despite these challenges. And we hope you'll join us in continuing to support the team in Fondé-Blanc as we continue to confront this unprecedented time. Just a quick heads up that unfortunately Comcast in our area has had internet problems, and so you may lose slides during this time. Dr. Kade and Melissa will continue with the presentation regardless, and we'll have time for question and answer at the end of the presentation as well. So thank you. And Dr. Kade.
Yes, thanks, Connor, for the introduction. And my name is Wilfried Kade, and I'm the Chief Medical Advisor for Health Equity International. I'll give you, and I'm also a pediatrician, and I was a former hospital director at Saint Boniface Hospital in Fondé-Blanc. Next slide, please. Connor mentioned unprecedented humanitarian crisis. And we say unprecedented because we've never seen this before. In my whole life, I've never seen anything like this in Haiti before. And how did we get to this point? We have to look at how this whole situation has impacted the economy and how the economy makes it an unprecedented humanitarian crisis. We have a rising inflation. From the graph that is being shown to you, you can see inflation rate has shown a steep rise between October 2021 and January 2022, from 19% to 24%. And since January 2022, it has continually risen month after month. In July, the inflation rate was estimated at 30%. Next slide, please. Sorry for the title of the slide in French, but this slide depicts how consumer price index was affected by inflation between May and July 2022. In green, you have the price index in the southern region where HEI operates. Prices in the south were always highest in the country. From the natural disasters in the past 5 years, we had Matthew, in 2017, Hurricane Matthew, we had an earthquake last year. So serious, and also serious gang activity that really started at the southern exit of Port-au-Prince. As time goes by, the tendency did not change. Bigger rise of prices seen in the southern peninsula right now. Next slide, please. So we mentioned the gang activities. And because of the gang activities, fuel cannot be distributed throughout the country. More than 800,000 gallons of fuel are being kept in the dock and cannot be distributed throughout the country. On top of that, the government has increased fuel prices by 100%. And the fuel being available only on the black market, it's being sold at 10 times more. With this situation, the minimum daily wage has not increased, has not been adjusted. And a small bag of drinking water, we're talking about an 8-ounce bag of water, the price has increased by 75%. The rice, the bag of rice has increased by 46.9%, the cooking oil by 91%, and the dry beans by 31.2%. Next slide, please. On this map of the metropolitan area of Port-au-Prince, you see how the gangs activity activities in the metropolitan area of Port-au-Prince. The bigger the dots, the bigger the size of the gang. So basically in every single area, there is a gang that is causing trouble. So how this is impacting access and utilization to social services, this is what we're going to see in the next slide. Overall, there are about 200 gangs around the country, but mostly and around the capital city of Port-au-Prince. The most notorious gang leader, by his rhetoric, he makes the G9 gang, which is basically an alliance of many other gangs in Port-au-Prince. So this gang is blocking access to and delivery of the 800,000 fuel to the country. The whole country is suffering from the repercussions of those gangs' criminal activities. We have 1.5 million people that are direct victims of those activities. And this whole situation has caused more than 18,000 internally displaced people. And we're not reporting here all the people who are fleeing the country to the Dominican Republic, Chile, Brazil, Guyana, United States, and Canada. Next slide, please. So in terms of impact of healthcare activities, a survey of healthcare facilities conducted last September, about 1 month ago, revealed the following, and I'm going to highlight only, the good side of this very dramatic picture, the results that they found. 45% of health facilities are still offering emergency services, which means 55 are not offering any emergency service. Only 32 are still providing internal medicine care, pediatric care, and obstetrical care. And 27% of those facilities are providing surgical care. Schools remain closed. Only a few schools are providing online classes, but this is also very, very challenging because of the whole context of fuel crisis, power availability for cell phone towers. Repeated lootings happened in September, humanitarian assistance from international agencies and organizations. Those lootings have caused a loss of $6.8 million, denying access to 250,000 people who could have benefited from food rations. Next slide, please. In the midst of all this, about 2 weeks ago, there was an outbreak of cholera in Port-au-Prince, not this time, not outside of Port-au-Prince, in Port-au-Prince. But we can understand because of this crisis and access, problems of access to these services like water and sanitation. So that has created the best environment for cholera to come back and hit the population. So immediately the Ministry of Health has started some community health mobilization to really raise awareness of the population. And on the same token, Health Equity International and St. Boniface Hospital have also started community outreach activities and distributed water treatment tablets to the population to help prevent from getting cholera. And at the same time, we're setting a cholera treatment center in Fondé-Blanc. Next slide, please. This situation is causing severe hunger in the country. So ideally, this map would be all in green, which would mean no hunger in Haiti. But what you can see in yellow are places there is with chronic hunger in the country, in orange, where this humanitarian crisis is at its peak. And so this will cause severe acute malnutrition, which we are going to witness over the next 4 or 8 weeks. Next slide, please. So in the next 3 months, this is a projection from one of the UN agencies. Close to 30,000 pregnant women, an equal number of newborns won't receive access to healthcare. 10,000 obstetric complications will be untreated. And what is very tragic about this last projection is those untreated obstetric complications may very likely end up with deaths. And 4.5 people are under threat of hunger. We just saw that. And there will be 7,000 victims of gender-based violence. When you have that kind of social unrest, either domestic or from external sources, people are being victim of rape and other types of assault. Next slide, please. So what has made access to services difficult is the whole crisis, which is punctuated by barricades being erupted everywhere throughout the country, on the main roads for sure, but also inside roads. And so that's why circulation of goods, food, water, fuel, and people cannot even go to work, children cannot even go to school. So that's this picture really depicts, and again, those barricades, people are trying to be very innovative when they have to erect those barricades. Thanks. Next slide. So this slide really summarizes everything that I spoke about, but it's also a transition to what Milica is going to present to you in terms of these are the challenges, but also it will help you appreciate, I believe, more the tremendous work that the Haitian staff and the local staff is doing in Fond-des-Blancs and in other places in Haiti to keep providing services, especially healthcare services or education or water to the population. The fuel shortage is having a serious impact. The ports and the customs are closed. St. Boniface has about 15 containers that are kept. Our customs cannot be moved out. We have serious communication issues. And so this whole situation makes it very challenging to provide healthcare, but the local staff is stepping up and really embracing the challenge. So thank you for your attention. I'll pass it over to Milica to continue.
Thank you, Dr. Cadet. I am Milica Michel, the Operations Director of St. Boniface Hospital. I will be telling you exactly how we're functioning at this moment on these unprecedented situation that we are confronting in Haiti. Next slide, please. Despite the situation in the country where many hospitals reduce their activities or completely closed, St. Boniface Hospital remains the only hospital fully operational in the South. So we can also say that we are one of the few functioning in the country. Even with the fuel shortage, the average number of patients at the outpatient clinic have increased. But we are not closing and patients have fewer options. They have to come to us since the other centers are closed. Next slide, please. One of our essential services, such as the ER, continue its operation. And besides of the fuel shortage and the increasing of the price of the transportation, we do see a rise in the flow of the patients. Maternity is another service that is constantly working. And it is also, I can mention that, a beacon of hope for women delivering babies. During those unprecedented situations, we have observed women in labor coming to the hospital on a motorcycle. As an example, in the beginning of September, we had one woman who came from Petit Goâve, which is 90 minutes distance from Fond-des-Blancs. She was refused at the health center there. So she had to take a motorcycle. She paid a tremendous amount of money to get there. She had to go through many barricades. They let her go through because of her pregnancy. She arrived in labor at the hospital. We just had enough time for her to transport her to the maternity ward. An hour later, she had delivered. We're still performing C-sections. We can see the comparisons also of the number of deliveries babies from August 2020 to 2022. And we still, even though we have all these problems in Haiti, working through that. Next slide, please. With the fuel and transportation, we do have problems there because this is one of our main challenges. Because of gangs blocking access to the terminals of the country. And we are being a rural area. We do rely on fuel to be fully operational, and usually it comes from Port-au-Prince. So this is a main challenge for us. We have the generators who have to function like that. We do have an ambulance service for the area, and it's getting very difficult due to the lack of food. This impacts also our supply chain, transport of medicines, and procuring oxygen. We are limited, but we do have functional on the NICU and surgery. Unfortunately, we had to stop the transfer of our staff at this moment, but it is also getting worse. The increase of price of fuel, it doubled already. Delivery from our suppliers is difficult, but sometimes also we need to refuel and procure to different suppliers who charge us high prices. Next slide, please. Our supply chain also have been impacted. Medication, we do have to get them from Port-au-Prince. So every time now it's a big challenge for us, how are we going to get it? And we have different scenarios now, and we rely, also on our network of suppliers and network of other organizations to see how we can improve that. We have the necessary needs for the hospital. So we make monthly orders now, and we have also bi-weekly orders on the food supply, on the water supply. Cash is another problem because now with everything that is happening, none of the suppliers accept checks because the banks are not closed, are not open all the time. And water, we have to purchase potable water, barricade and flu shortage. We have to depend on our reserves. And now we are also, at the same time, working independently to implement our own water system that we would have water supply, potable water there. Next slide, please. Due to the lootings and breakage of many communication systems across the country, all communication, phone, internet are not possible in Fond-des-Blancs for the past 3 weeks. So, and the reason now that I can present you the situation, because usually I am based in Fond-des-Blancs, is because I have been on vacation and I cannot return to Fond-des-Blancs at this moment, which is something that can help also because in order for us to communicate with the leadership on a daily basis, they have to drive to the top of a mountain to get signal. And I am I'm relaying the calls with Boston office. So to discuss all the needs and to be able to provide all the help that we can to help the hospital running at all times. We already are in the process of procuring satellite internet to have a better communication. In the meantime, we can make any contact for them on the needs of the hospital by us being available at all time to them. Next slide, please. We would not be able to do everything that we have there at the hospital without the staff. We have to know that their motivation, dedication inspires us to continue the work to provide the best possible quality of care during these difficult times that we are experiencing now. We couldn't have done it without them because they are always at their post around the clock, and we provide all the services, and we are being able to do it with our local Haitian leadership and local Haitian staff. I'm thanking you for your time. Now, Dr. Cadet, Connor, and I are happy to answer questions.
As Melissa said, and thank you, Melissa, and thank you, Dr. Kade, for those reports and relaying of the incredible difficult situation that we're confronting, but also the heroic work of the staff despite tremendous odds. Are there any questions from those who are participating? John Leary, I can see that your hand is raised, but if you can put any questions you have in the chat, that may be the easiest way to do this. One question to Dr. Kade and Melissa is, what can we do to help, from Nancy Rose? Dr. Kade, could you hear me on that one?
Yes, I heard you. I said, yes, I think it's really challenging. I think moral support is one thing that we definitely need, but also we need supplies to keep providing services to the population. I think the immediate way, I think, for anyone to help now is to do some advocacy work in terms of like sensitizing the American people and the community where you live about the humanitarian crisis in Haiti, and rallying people together around this cause so we can voice our concerns to whoever is making the decision at the highest level. So they need to bring a response to this threat. To this, it's not a threat anymore. It's there, the humanitarian crisis. So I would say moral support, and number two is really financial support for us to keep providing supplies. And the third one, which is not the least, is really advocacy. So the right decisions are made to really address this humanitarian crisis.
Thank you, Dr. Kade. I would just add too, because of the remarkable work of the team in Fondé Blanc in terms of figuring out ways to solve different parts of the crisis and the need to be flexible. Funding is something that we can use in a flexible way that allows us to respond to challenges in real time. For example, we're not able, we can't run the hospital without fuel for generators. We're completely off the grid. We need that fuel. Fuel can range anywhere from 2 to 3 to 4 times as expensive as what it was before for us to purchase. Melissa might find somebody in Lakai and say, we can get 1,000 gallons, let's get them today. Or she might find, we can find 5,000 gallons in Port-au-Prince, and the population will allow the trucks to move out because they want to protect the hospital. We need to be able to be flexible and spend those funds to have that kind of flexibility around fuel, around communications. We need to set up a satellite dish in the hospital. Let's set that up right away. Let's figure out how to get meds and supplies from a Port-au-Prince warehouse and helicopter it out to Fondé Blanc through the UN. The local knowledge and understanding and figuring out how to do things on the fly is really critical, and flexible funding allows us to have that kind of flexibility to just keep everything running. Another question is from Lynn Black, which says, thank you for presenting this. The situation is clearly dire. What is needed? Melissa, can you speak to that?
Yes. We practically out of stuff on medication. We need to find a way to get everything there. We are trying on solutions right now, and we're doing our best for that. Also, like Carno had mentioned, fuel is a necessity down there. Things for like for the maternity or the pediatric surgery, we need everyone to help and send the equipment, if we can get some equipment for that. We are in need also now. I saw that there is a question on cholera. We do not have any cases yet at the hospital, but we are preventing that. And we like Dr. Cadet had mentioned also, we are ready, and we establishing the center right now, getting prepared. But we will need extra medications or anything that is necessary to treat cholera. So, and for the kids, malnutrition, necessity, proteins, whatever is needed, to have necessary things to function at the hospital. The supplies are very low. We are doing our best to provide that. We have a strong network of suppliers, but the thing is, like Connor had mentioned also, fuel. We paid sometimes, we have to send for 1,000 gallons sometimes to that. We procure it at 5 times already more than what we have, the price of fuel. And the funding, is necessary for that. Thank you.
Thank you, Melissa. One question that I'll try and take is from David Barish, who asks, in addition to material goods and funds and moral support, is there a need to get more media and or political attention on the issues? And I would say absolutely. I think there has been significant media coverage about the political situation, but I think the overall humanitarian situation is not highlighted in terms of just how dire the situation is currently in Haiti and what we're up against in terms of the coming weeks if things don't change. No, Dr. Cadet and Melissa talked about that at length, but we've been going on now where our team has been almost completely under siege and our patients have been under siege without the ability to move normally or to be able to procure basic goods, commodities, food, meds, supplies for the last 5 weeks. If this continues, this can't continue. There's no way in terms of the humanitarian disaster that this can continue at this level without having major impacts on lives in Haiti. And so we want to make sure that media sources and others are talking about the dire humanitarian situation, not just that there's a political situation that needs to be resolved, but that there's also a massive and unprecedented humanitarian impact as well. I don't know, Dr. Cadet, if you want to add anything to that as well.
I want to add something more about nutrition and I showed in the map that there is chronic hunger in the country, and some regions are also already under humanitarian crisis in terms of access to food. But what is coming, and it's already there, is acute malnutrition. Whenever the situation is addressed and resolved, we have to do what it takes to address acute malnutrition in the country. What I mean specifically is really food aid massively to respond to the acute malnutrition that is on the rise in the country. And there is a question, I see that there is a connection issue with our Newton colleagues. I'll mention that there is a question about the school. I am a strong partisan of education. So I think as much as we can, we should keep the funding for the school in Shasha. And since in terms of social protest, and there is not much going on in Fond-des-Blancs, so I would definitely encourage the school leaders to reopen, to have some kind of mechanism for the kids to receive materials, to come to the school to pick up materials and to go home, do their homework and bring them back. And I know that will put the school leadership under pressure from some community members, but I think we have to be innovative, just like we are being innovative to keep providing healthcare services to the population in the midst of all this, in keeping education is also critical. To me, that's the future. And as I was explaining to Connor in the previous question, sorry for being long. Those gang leaders we see today were neglected 10 years ago, 20 years ago. They were not given the opportunity to go to school and really fulfill their dream. And that's why they have turned to violence. So we want to break this cycle of violence or gang activity, and education to me is the solution.
And continuing also on Shasha, the school, since the increasing also of the pricing of the food, we do provide meals for the kids. So even if they are also attending the school, so their meals, their lunch is given to them. So this funding, we will have to reevaluate and see how we can provide all the necessities to them.
There is a very important question about alternative transportation routes. Yes, I mean, some things have been explored, and actually at some point the organization was also talking about purchasing a barge to ensure transportation between Port-au-Prince and one of the southern ports, and where the goods would be collected and carried by wood to Fond-et-Blanc. Yeah, that has been explored, but with some level of dysfunction with the government, it has become difficult. Another route that has been explored is really through partnership with the UN to really fly a helicopter to bring some medical supplies to the hospital. Actually, that is something that we have explored as well with our UN partners, especially the Pan American Health Organization. And we had this conversation with the United States Agency for International Development, USAID, to see how they can be part of that conversation to really maintain supply chain for hospitals and healthcare facilities throughout the country.
And I would just add to that, Dr. Kade, what has been, we as a leading healthcare provider in the country have been working with all different partners from around the country to think through supply chains generally and transportation. And there is no solution currently. We're finding ways to do it in a piecemeal way with a helicopter, from the UN or from other groups at different times, but there is no comprehensive plan or strategy that's being put out there yet in terms of how to solve the supply chain or to develop what could be called humanitarian corridors. There's nothing yet, and it's quite concerning.
There is a big question. How do we get the funds to Haiti to help? The mechanism for wiring.
Well, as we know, the banks are open only 3 times a week. And Fond-et-Blanc being short of communication, while I am here, the mechanism that we're using now, it's the contacts to the suppliers and everyone. So everything is going through the Boston office right now. And I relay everything, and we do wire the money to the suppliers like that and make sure that everything, as we can go get the fuel or whatever supply is needed. That's how we're functioning right now. So everything has to go through HEI, and then we forward it actually for the hospital and what is needed.
Yes, and to summarize, Mutsu, we are still able to take funds in here at the organization, and we are able to get that funding to Haiti. Sometimes we do direct wire transfers to large fuel suppliers. Sometimes we figure out through other local banks how to make payroll. You were able to find very creative ways to make sure that all of our staff was paid, and that we're able to pay suppliers as well. So despite all those challenges, we are still able to make all of it work. So if people are able to send funding here, we are able to get it into Haiti.
Yes, I mean, I really want to emphasize the impact of this crisis over services like healthcare and nutrition and food. I mean, to me, it's critical. When we think that 30,000 women, pregnant women, will not have the necessary prenatal care, and with complications that may occur, which may end with severe fatalities, that's pretty scary. And I think that's how we need to join our forces and our voices together to advocate for some immediate answers to this humanitarian crisis. And so to me, someone was asking, what else can be done? Really advocacy, daily advocacy for a response to this humanitarian crisis is critical.
Thank you. There was a question about how we can access this webinar in order to share it with others. We are doing our best to record it despite Comcast internet issues. Assuming the recording worked, we will send a link out to everyone afterwards to make sure that you're able to share it. If not, we are going to try and figure out alternative ways to make sure we're getting the word out, because we think this is absolutely crucial and a lot of this news is not reaching everyone. There's also a question here about are alternative transportation routes being set up, alternative ports, airdrops, et cetera, to keep the health system and food aid going. As of right now, we are not aware of those alternative systems. We are really advocating and bringing together a bunch of partners. Today, we've been talking to a number of different partners within the country to get all of us together and start to advocate for alternative corridors for moving goods, critical goods and supplies. We're not sure where that's going, but we're really trying to push and take a lead role. Our team is in Haiti to make sure that we're pushing for the ability to move critical goods and services. I think it's a really great question.
On this point also, we are working with other institutions to have sometimes to create a humanitarian convoy. So to see how we can help, especially the South, it is getting worse at this moment. So we are really doing our best to work with everyone and see how we can provide that.
I see a question from Barry too about questions around US and UN military intervention. What we've been saying is that from a humanitarian perspective, the time to act was yesterday. We are behind in terms of being able to respond to this crisis, and we can use all the help we can get. We're not being prescriptive about what that looks like, but we know that there need to be corridors that are set up, and we know that we need to be able to support our team in being able to provide critical goods and services, and more importantly, to provide our patients and the communities that rely on our services the help that they need as well. What that looks like, we don't feel like we have the answer or have a prescriptive answer. It's something we've talked a lot about internally as a group, but that we really just want to advocate for a humanitarian intervention writ large as quickly as possible, given just the stakes of what we're dealing with.
Here's a message from Rachel Bernard.
Yes, Rachel, of course, anything that you would like to share with anyone within the Haitian Health Network, we're happy to have this shared. Happy to have people share this far and wide. Any additional questions? There's a question, Melissa, I think we'll give to you, which is, how are the staff at St. Boniface Hospital staying safe?
Well, so far, everyone, the situation is stable in Fond-des-Blancs. We do have other networks also working for us to let us know what is going on outside of Fond-des-Blancs, but there is no movement, actually. The staff really stays in Fond-des-Blancs, and because of the fuel shortage, we had stopped staff transportations which were happening 3 times a week. But they do understand the situation, and they, even now with no communication, they cannot have any information on their families. But we are doing our best that to provide them, some access to the internet, and we are working fast on it, and to continue and be able to have everyone available. On their payroll, that was the same thing. There were problems for that because of the banks not being open, the necessity for purchasing what their needs for the month or for the week. It was really difficult. So we accompanied them also on this and prepared some kind of advancement of funding, whatever they needed to have them staying there and be able to provide for themselves. They do have also weekly meetings on whatever is happening and how they will work on different aspects. And also some of the services, daily meetings to be able to stay. And we also inform them on the situation. While we have our daily calls with the leadership, we do inform them on the outside situation in the country. So they are able also to have anything information. But so far, everyone is safe, thank God. And then we will continue to accompany them as much as we can so they can they continue to work. And as I mentioned before in my presentation, their dedication and motivation is, I don't have a word for that, because they are really, really working very hard to keep the hospital running.
Absolutely. Any final questions? Just a reminder, Lisa Epic has put that in the chat as well. We will share the recording after today's event. Please feel free to share it with your network. And we will continue to have these webinars as there is more news. We want to make sure that everyone is updated and you're able to ask any questions about the ongoing situation and how our organization and others are trying to confront it. But just really grateful for everybody's time today. Thank you for joining. Thank you for all your support. And thanks all, and we'll hopefully talk soon. Thanks, everybody. Thanks, Dr. Kade. Thank you, Melissa.
Thanks, Connor.
Thank you.
And thanks, everyone.